Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're exploring a newly available, truly long-acting biologic option for severe asthma, Exdensur. Approved by the FDA in December 2025, it becomes the seventh biologic therapy in the asthma treatment landscape. And it is fair to ask, do we really need another one, especially when many of the existing options already work well for a lot of patients? But here's what makes Exdensur stand out. It's designed for ultra-long control with dosing just once every 6 months. That is right, 2 injections a year. For many patients, that kind of schedule could significantly improve convenience and adherence. To understand why Exdensur matters, we need to talk about eosinophils. Eosinophils are a normal type of white blood cell involved in immune balance, tissue repair, and defense against certain parasites. But in some people, eosinophils become persistently activated or overly active, and that can sustain airway inflammation, leading to frequent exacerbations and increased steroid exposure in severe asthma. One of the main signals behind eosinophil activity is interleukin 5, or so-called IL-5. Exdensur targets this pathway by blocking IL-5, helping reduce eosinophil-driven inflammation at its source. In previous episodes, I covered Nucala and Fasenra, 2 other medications that also address eosinophilic asthma through the IL-5 pathway. If you have not watched those yet, the links are above and in the description below. But today, our focus is Exdensur, which is engineered for durable IL-5 suppression, and that built-in durability is what supports its extended dosing interval. So, in this video, we will walk through the 5 key things every patient and caregiver should know about Exdensur: its indication, how it works, how to take it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more evidence-based medical updates. Now, let's dive in. First, what exactly is Exdensur and who is for? Exdensur, or Depemokimab, was approved by the FDA in December 2025 as an add-on maintenance treatment for severe asthma with an eosinophilic phenotype in adults and adolescents ages 12 years and older whose asthma remains uncontrolled despite their current medications. Because Exdensur is designed for sustained effect with a twice-yearly dosing schedule, it may also be well positioned for future studies and potential future approvals in other eosinophil-driven or related conditions, where long-term control with fewer injections could be especially helpful. As with all asthma biologics, Exdensur is not a rescue medication. It does not replace quick relief inhalers or emergency treatments for acute asthma symptoms or attacks. Instead, it's intended for disease control, reducing exacerbations, limiting steroid exposure, and helping patients maintain more stable condition over time. Second, how does Exdensur work? In eosinophilic asthma, IL-5 promotes eosinophil production, activation, and survival. When this signaling remains active, eosinophils can build up in airway tissues and cause chronic inflammation, contributing to recurrent exacerbations. Exdensur works by binding directly to IL-5, preventing it from activating its receptor and driving that inflammatory cascade. By neutralizing this upstream signal, it reduces the fuel that sustains eosinophilic inflammation. What sets Exdensur apart is how it's engineered to last. Exdensur contains a specific 3 amino acid YTE modification in the Fc region of the antibody, which increases binding to the neonatal Fc receptor, FcRn. This enhances recycling back into the bloodstream, reduces degradation in the cell, and extends the drug's half-life. As a result, Exdensur can be dosed every 6 months while maintaining therapeutic effect throughout the dosing interval. Third, let's talk about how to take Exdensur. Exdensur is given as a subcutaneous injection using either a prefilled syringe or a prefilled pen. For severe eosinophilic asthma in adults and adolescents ages 12 and older, the dose is 100 milligrams every 6 months, making it the longest dosing interval currently approved for asthma biologic therapy. For comparison, one of the longer maintenance intervals among existing asthma biologics is Fasenra, which can be given every 8 weeks after loading period. Exdensur extends that even further, down to twice a year. Another important point is who administers it. Exdensur is recommended to be given by a healthcare provider rather than self-injection. In real-world practice, that can fit well with severe asthma management because many patients often require ongoing monitoring and follow-up, sometimes more frequently than every 6 months. So patients are usually being seen regularly anyway. Injection sites include the thigh, abdomen, or upper arm. If you miss a dose, contact your healthcare provider so you can receive the next dose as soon as possible and get back to the schedule. Fourth, let's review the warnings and precautions for Exdensur. The most important concern is hypersensitivity reactions, including anaphylaxis, which have been reported with Exdensur. If signs and symptoms of a serious allergic reaction occur, such as breathing problems, hives, rash, dizziness, fainting, lightheadedness, or swelling of the face, mouth, or tongue, patients should contact their healthcare provider or get emergency help right away. Next, corticosteroids, whether oral, injectable, or inhaled, should not be stopped suddenly when starting Exdensur. Any steroid taper must be gradual and supervised by a healthcare provider to avoid withdrawal symptoms and to reduce the risk of worsening disease that was previously controlled by steroids. And lastly, because eosinophils can be involved in defense against certain parasites, it is not known how Exdensur may affect the body's response to parasitic infections. Any existing parasitic infection should be treated before starting Exdensur. If a patient develops a parasitic infection during treatment that does not respond to standard antiparasitic therapy, Exdensur may need to be temporarily stopped until the infection resolves. And finally, let's talk about the side effects and safety. In clinical trials involving patients aged 12 and older, the most common side effects included upper respiratory tract infection, allergic rhinitis symptoms like sneezing and a runny, stuffy, or itchy nose, influenza or flu-like symptoms, joint pain, and sore throat. Overall, these rates were generally close to placebo, with only modest differences between groups. Injection site reactions such as redness, swelling, or itching were uncommon. In the trials, they occurred in about 1% of patients receiving Exdensur, compared with less than 1% in the placebo group. In short, Exdensur appears well tolerated and offers a reassuring choice for patients with severe eosinophilic asthma. And there we have it, 5 key things to know about Exdensur, an ultra-long-acting biologic approved for severe eosinophilic asthma in patients aged 12 and older. with dosing only once every 6 months and a safety profile consistent with other biologic therapies, Exdensur introduces a distinct new option in the management of asthma. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.